Hi, I'm Ray Solano, pharmacist and owner of Prescription Dispensing Labs, and we're here today talking about perimenopause, what every woman needs to know before she feels broken. I'm Ray Solano, the owner of PD Labs, and thanks for joining us today on Healthy Choices. And Healthy Choices is a long-term podcast that we have, and we're really excited about being on Doctor Talks. And we're talking about a topic today that affects millions of women. I think there's more people are affected with menopause in is the most that it's ever been in the history of mankind. I think this is what the statistics are. It not only affects millions of women, but there's far too many that feel confused, dismissed, or really just unprepared when it begins. And one of the things that we're seeing is that it's just somehow has been a lack of education and a lack of ability to treat this. And that's what we're talking about is perimenopause, which is a transitional phase that can before menopause that can bring hormonal fluctuations, sleep disruption, mood changes, weight gain, anxiety, and brain fog. And for many women, this is seen to be extremely uncomfortable and overwhelming. Sometimes it's called just stress or it's just getting older. And that's the reason why we're so excited to get Dr. Jennifer Flagar. eh, As known, many of her patients know her as Dr. Jen. She's an expert in perimenopause and she's double board certified in emergency medicine and integrative medicine. And she's trained at the Lake Erie College of Osteopathic Medicine and St. Vincent's Mercy Medical Center. So she's well experienced in this area, and we're so excited to have her on our show today because this area of medicine is the most explosive uh, resurgence of what we're finding for helping patients really get to the root cause of the what patients have. And we're finding that many of as we go to many of these conferences, the amount of new practitioners that are waking up to the proper uses of hormones and lifestyle to relieve these symptoms, which is it's seems like there's a resurgence. So welcome to the program. So let's start at the beginning. What first inspired you to help you move from conventional medicine to integrative medicine?
Yeah, thank you for having me, Ray. This is going to be really fun. So, I was working in the emergency room and out of residency, I did a 3-year residency in emergency medicine, started working at community ER. And this was different from the level 1 trauma center I was working at, where I was seeing more community, more of the community patients out there. And they were not getting better. They would just come back for the same complaints. They were seeing their doctor, not getting better, not getting answers. It's just such a broken system. And I remember this one patient was in there for chronic belly pain, was on all the medications, and I would see her every couple of shifts I would work. And I'm like, look, you are not getting another CT scan. Let's sit down and talk about your diet. And I, you know, went home to my husband and I was like, I need to do a fellowship in integrative medicine. I had been reading about Lyme and gut health and different diseases. And I was really getting frustrated with seeing chronic diseases in the emergency room that could have been prevented. And I went to school as a DO. I thought the body functioned as a whole. And what we have with conventional medicine is a lot of specialists, a lot of compartmentalized, like
Right,
the
right.
body. Yeah, right. Like ENT, ear, nose, and throat, and then a lung doctor and a kidney doctor. But really, everything is related. So almost like going back to my roots doing integrative medicine, practicing integrative medicine. And then I still work in the emergency room from time to time. And I had a brick and mortar practice in Ohio for 10 years in office. And I was really kind of the only one in Northwest Ohio practicing like this. And then recently we moved to Tennessee and now I have a virtual practice and can reach, you know, everyone. I'm licensed in multiple states. So that is very helpful. But It was important to me to get board certified because I knew that my conventional medicine colleagues would look down on me and say it was snake oil and this is not what you do. You have to prescribe pharmaceuticals, and their patients are not getting better, and mine are. So
Right.
it's a very broken system, as you know. But you being a pharmacist, medications play a role. And sometimes we're using them off label because the pharmaceutical companies are who pays for these large double-blind placebo-controlled studies. But if we look at other medications like Vioxx, for example, they had all the studies, but they kind of made them what they wanted you to see, and then it got out there on market, and it was a very dangerous drug. So, we have to use discernment. We have to be clinical in practice and make sure we're also looking at the patients in front of us and do like we used to do old school, right? Like remember going to M&M conferences where you discuss with your colleagues what's actually happening in the clinic and learning from each other. We need to bring that back. So that in
Right.
the functional integrative world, that's what we do and that's why patients get better.
One of the things that I was kind of surprised. I went to a women's health conference in Las Vegas that was it was really allopathic nurse practitioners that usually practice in hospital and in traditional settings. And I was shocked that over 90% of their people have never even prescribed progesterone. And they were
What?
it was like I was like pinching myself. I felt like I got lost in a time warp, and they wouldn't ever touch estrogens. And it was they had denied women the replacement levels that they needed as because they said that their institution didn't recommend it. That's not something that they felt comfortable with. So the fact that they just recently took off some of these black box warnings, it just seems to be just opening up for women to really be have. There's no sense suffering and putting them on antidepressants. It's like it's starting
Right.
all over again. Is that do you get the same feeling?
Yes and no. I guess I'm a little bit more critical. I read the new position paper and they're still pushing for drugs. They're still pushing for some of these new drugs. And then also they're still not giving progesterone what it needs to. So you can still see that there's some big heavy dollar influence on there. So
Right,
they're still recommending that if a woman doesn't have a uterus that progesterone is not needed, and that is not true. Progesterone should be given to women even if they don't have a uterus. So progesterone, when it started out, progesterone was given for women in menopause if they still had an intact uterus to prevent that uterus from endometrial cancer or overgrowth of cells in there. Progesterone was given. But progesterone, it has so many other reasons to give it for women. And then when we look at the older studies in the Women Health Initiative, they weren't using progesterone, they were using
just
progestins.
ends.
Yes. So there's still so much work to do. I mean, I think that this just scratches the surface what has happened over the last few months. Now, for women listening, why do we need progesterone? Well, progesterone is a balance to our estrogen and estradiol. It's protective for the breast, for the endometrium. It is protective for cortisol, your mood, and what happens in perimenopause or the transition from being a normal cycling woman to going through these anovulatory phases and then eventually menopause is that our progesterone just keeps going down, just a steady decline.
Right,
And you start to feel it and these women start to feel it. We're seeing some studies that women are experiencing perimenopause symptoms in their 30s, like in their early Thursday, 30s because they're driving down their progesterone even more
yeah,
by this relative estrogen dominance could be a factor. So then when you're supposed to be balanced, your estradiol and progesterone, it's even more big of a jump. So you're feeling these symptoms more. Plus cortisol or poor blood sugar balance is driving it down further. So, giving these women in perimenopause progesterone during their luteal phase or their second half of their cycle is life changing. So, we're mimicking that cycle. We're giving progesterone just that second half, just how God intended when we're supposed to have that more dominant during our luteal phase, preparing the body for pregnancy, for that egg to settle in that endometrium. That is when it really helps women because in that luteal phase, if the progesterone is not shining, if it is very low, if our estradiol is super high, that we're still
Right.
feeling, yeah, I mean, that is when we're having irritability, heart palpitations, snapping at our children, really bad PMS and cramps. And then that goes into really heavy cycles. So this is where women that might not have had these symptoms before in perimenopause when that progesterone is going down is they're really noticing it. And this is when they go to their doctors with the complaints like I have anxiety now, I have heart palpitations, I'm gaining weight, and then they're put on birth control which is synthetic hormones which don't have the same physiologic action as our bioidentical hormones. And then, like you mentioned earlier, they're put on antidepressants. And this is just horrible. I mean, there's about, 8 million women in perimenopause right now. And I bet you less than 2% are getting proper treatment.
That's really scary.
Oh yeah.
Less than 2%. And have you seen the new classification of drugs that are coming out for treating for menopause that are non-hormonal? It's an antidepressant framework,
Right.
working centrally for non-hormonal and the liver enzymes, elevation of liver enzymes is the biggest side effect. And they're told
Horrible.
women that they're told to to refrain from any alcohol use at all. And I just sit there and just I was scratching my head as I was talking to her. I says, that's the hardest thing we have is the excessive use of alcohol with women going through menopause. And you're going to be, and I just the compliance issue is going to be awful. And then
Yeah.
because their liver enzymes are going to be high, and it's just such a awful solution. I think they banked on non-hormonal medications to be the mainstay for the next years because these drugs have been researched 10 years ago. So
Yeah, yeah, and well, let's break that down. I mean, if they're classifying it as non-hormonal because they want to appeal to people being more natural. So that's some greenwashing going on there, which is
right,
very inappropriate. And a lot of these medications are metabolized through the liver. So if we have polypharmacy of pharmaceuticals, a lot of them are metabolized through the liver. Now, to be on the other side, there are supplements that you know don't buy supplements on Amazon because they can be adulterated. They could have heavy metals or pesticides in them, and those are clogging up the liver too. I have seen it. I had a patient that was in acute liver failure from a turmeric supplement from a decent company, and I'm like, don't use that supplement company anymore. You
wow,
know,
scary,
yeah, it was crazy, and everything normalized, but if we look at the liver, our liver is our detoxifier. It is really busy. Think of it like a post office, okay? The
right,
post office is moving smoothly. Everything is getting sorted through the different cytochrome P450, all these different enzymes breaking things down. So we have phase 1 is the liver, and then we have phase 2, which is the end packaging, maybe putting it on the truck in the right part. And that's glutathione and sulfur helps with that. So if we focus on phase 1 of the liver, so if this gets clogged up with things like prescription drugs or alcohol is a big one, then we have our estrogen molecules coming in that need to be broken down and taken out of the body. Well, alcohol is a toxin. So alcohol is going to tie it up. It is like going to be like first class mail. It goes first, or, priority mail. I would say that's a priority. And then all the other packages are going to get pushed aside. This isn't going to kill us right now. This isn't a toxin. We got to focus on the alcohol first. So that is really hard for women because we have to detoxify this estrogen through the liver into different pathways called 2-methoxy, 4-methoxy, and 16-hydroxy. So these are the different pathways to get estrogen safely out of the body. What happens is some of these pathways are more toxic and so can lead to more quinones, we call them, or they're um, toxin cancer producing. Okay. So we have to make sure that we are packaging up our estrogen and getting it out. So if we have things like pharmaceuticals or alcohol, that is going to affect that. This is why women now, we used to be able to have one drink and that would not increase our breast cancer risk. Now I believe it's zero
Right.
where men can have a drink still every day and not increase their cancer burden. It's because of the estrogen, and breast cancer is something that women really should be looking in their 20s and 30s, prevention in their 20s or 30s, not not later. So this is a big frustration with me, and I am so picky with my patients on looking at estrogen metabolism, looking at liver health. If there is environmental toxins like mold can really clog up that liver too. So we have to look at the whole picture. And pushing pharmaceuticals on women that actually say you can't drink on them because it's so toxic to the liver, that is not good. So when it comes to alcohol in women, I just don't think they're being told how dangerous it really is. And I'm not saying don't drink at all. It's just what are we using drinking for? Is it like, how we treat a dessert where we're not having it all the time? We definitely don't want to be binge drinking. I enjoy a nice old fashioned with a big cube every once in a while, but I'm not doing it in excess. I'm not doing it to escape my life. I'm not doing it to relieve stress. Now, to be honest, I don't know about you, Ray, but like medical school, we all drank so much in medical school. We had so much trauma, so much stress, and weren't given any good resources on how to deal with all the stress we were under. So, like residency and medical school, because of all the trauma we were going through, we drank a lot. That is horrible.
That's what.
So,
Right.
yeah. So really like with my book, The Perimenopause Reset, it's a faith-based book. It is we want to give those burdens, give that stress to the Lord, to read scripture, to meditate on scripture, and that can really help. So we always have to peel back and look at the root cause of, why are we drinking alcohol? Why are we making that choice? Because it is going to have a long-term effect of increasing our cancer risks and messing with our hormonal health.
You said something it's so important that getting their estrogen metabolites and
Yeah.
being able to quantify those for women, eh, just period, is something that's not it's not a mainstay. It is almost uh, a new concept for many practitioners, and it's especially if women are overweight. And you can look around, and I see as well. You've got about 50% of the population, especially women, that are overweight, and it's just downright dangerous
Yeah.
for women to have 50 or 60 pounds for belly fat
Yeah.
in the 30s. I mean, it makes it a higher risk for cancer.
Yeah.
And being able to understand those estrogen metabolites, it's unfortunate as just giving it a pass that it's just okay. So I
Yeah.
like that you mentioned that.
It's tough. So talk about weight and being overweight for women. It's not just one thing and it's not just calories in, calories out. And it's really just so many things. And this is why it's so important to work with a physician or a functional medicine practitioner that knows what they're doing. So it can be so many layers. We can hold on to weight because we're not sleeping well, because we have high stress and cortisol, because our liver, we're not detoxifying. So our fat cells are just holding on to all those toxins to protect us. It could be thyroid, it could be estrogen dominance. There are so many layers to why we're holding on to this weight. Blood sugar balance, though, is so key. I really love implementing in women something called cycle syncing, where we're using science and we're making sure that they are eating and working out and fasting the correct time during our cycle, because we are working with our hormones. Because a lot of the times what I see the biggest mistake with women, the second half of their cycle, their luteal phase, they are still fasting really hard. They're
Mm,
still doing hit workouts, running, sprinting, all of that. Well, that second half of that cycle, we're less resilient. We're more sensitive to stress. And if we're driving up that cortisol during that part of our cycle, we can actually gain weight. We can actually, spike our blood sugar if we're fasting. And I've seen it in so many women that if we just correct that and let them rest, do gentler workouts, increase calories, that their body is more in homeostasis and does well. So it's hard for women. Like, I've had patients come to me and they're like, look, like, I only eat 500 calories a day and I'm
wow,
gaining weight.
that's
Oh,
right.
yeah. Like, you see a woman and they're overweight. A lot of the times they're not overeating. They're
Yeah.
actually like trying to lose weight by doing what? What their doctor tells them, cut calories and move more. And then they're gaining more weight. And
Body
one
goes in shutdown mode.
Yeah, yeah, your body is gonna conserve every weight because it literally thinks it's probably going to be the end, right? Your body's like, "This is the end. I'm just gonna conserve everything I have." Their thyroid shuts down, their adrenals do. So we really have to tell women to rest and to look at root causes. So one patient in particular that this was happening to, I thought it would be easy. I'm like, oh, we just need to balance hormones and blood sugar. Well, she was already doing balancing hormones and it didn't work. Um, we started working on her blood sugar, but she was insulin resistant because of a mold exposure,
Wow.
um, 10 years ago. Yeah, so her body was so inflamed. So we got rid of the mold colonization in her gut and in her nose, and she's like, "I can feel my cheekbones for the first time in 10 years." And
Wow.
then we're gonna continue to, detoxify her and work on that and balance her hormones. So that's what breaks my heart the most, I think, is that so many of these women that are gaining weight, or can't lose the weight, they are just stuck
Right.
and they are told to push harder, um, only eat steak every day, just push harder, you're already doing low carb, push harder, do more low carb, or, and it's like, no,
I
you
know.
can do that in your first half of your cycle. Push yourself during the follicular phase. You're going to do good. Actually, estrogen makes us more insulin sensitive. So you can even push that and get into ketosis earlier. You're not going to stress your body out. And then luteal phase, like, eat the calories. Don't eat brownies or cookies all day. Like, eat nourishing calories.
Right.
Give your body a break. Rest in that. Stretch your body. Don't have guilt in it. It's just this is why perimenopause is such like a special place in my heart, because this is what makes up most of my practice, because these women are just not being treated well in the conventional medicine world.
Well, tell us a little bit about your book. I see you have a picture there in back of you.
Yeah.
Reset, right? Tell us a little bit about your book.
Yeah. So it's called the Perimenopause Reset. And it is a guide from, top to bottom, root cause, how to figure out what is going on with your hormones in perimenopause. And it's beneficial really to everyone. Younger women reading it, if you're in menopause, and men. I think men, it would be good for them to read the book and understand women's hormones. A lot of the time, men in marital problems are pretty prominent during perimenopause because of the hormone changes.
Good.
And another problem I see, even in the functional medicine world, is that women will go to their doctor and be having problems, with intimacy with their husband or low sex drive. And they're just not even testing hormones. They're just putting them on tons of testosterone.
Right.
And that is not the problem. Usually it's cortisol and stress. So a lot of the root causes, and in the book we go through the environment, what in your environment is causing stress on your body? What in your environment is affecting your hormones, like endocrine disruptors? I mean, I go through all of the causes and how to swap things out and switch that. And then we go to the body. How is the body working with our hormones? I go in detail about estrogen detoxification and why that matters, and cortisol and circadian rhythm and sleep. It's all affecting our hormones. And then the third part is our mind spirit part of it. How does stress and cortisol play a role? How about adverse childhood events and trauma? We know that that impacts cortisol, that impacts our health. We talk about spiritual warfare and how that can play a role. We see a lot of women in perimenopause that they already feel isolated and alone because no one is listing their symptoms. So then the enemy is going to come in there and be like, "Hey, like, yeah, like you're in a bad spot. You need to just be more depressed and eat more." So we
Right.
have some spiritual warfare too. And then there's also a devotional in there. So kind of just it's meant to comfort women in perimenopause, but also give them actionable steps to help their symptoms. And I go over peptides and supplements in there too, also.
Well, because it's not just lifestyle, it's not just hormones, it's proper supplements also are very powerful
Yes.
as well to help balance hormones, help reduce stress, improve sleep, and
Yes.
it's also a big part. And I think this is why practitioners with the education and training like you have are so important for people to connect with, because let's be clear. Your colleagues and people that when you went to school with don't practice this area of medicine at all,
No.
and unfortunately, you're a minority. It's not a majority.
Right. Yeah.
I mean,
Yeah, it's unfortunate. And we also have to be careful. I don't know if you've seen this trend lately, but I have seen that a lot of the functional and integrative people, or everyone's coming out with a wellness med spa, and they might not even have training. So you always have to check to see if people actually have training, because everyone's calling themselves anything they want.
right.
And then I'm also seeing just over supplements, like over supplementing everyone. And we're almost just as bad as conventional medicine doctors. We're not getting to the root. We're not sitting with our patients. We're just doing the same protocols, and it's not personalized. So that's the other thing that I'm starting to notice lately. And I'm like, but are you like actually treating patients individually, or do you have them on all the same detoxification plans? And they're all doing that. Are you just as bad as a conventional medicine doctor giving medications with supplements?
And yeah, somebody taking 15 different supplements is not the answer. And especially if they're not getting any better. And like you mentioned, it could be situational with work and marriage. It could be also environment, and mold is a huge part. Is why
Yeah.
the body was not reacting. It's just shut down. So it's really important to really play that detective work, and that's why it's incredibly important the work that you do. And I think it's great. Don't wait to menopause is occurring. Let's get it in a before why the body's has still has those ability to produce those estrogens and
Yeah.
slow that process, because you shouldn't really be giving estrogens when women are in perimenopause. Would you agree?
Oh, can you repeat that?
You just don't give them more estrogens. It's just over and over again. We see it, and they come
Yes.
in and on top of it, if you're overproducing estrogens and you're have a tremendous amount of belly fat, that's excess estrogens.
Yeah.
So just stop.
Very. Yes, very dangerous trend I'm seeing is that people are trying to mimic a cycle. Oh, we're going to mimic your cycle in perimenopause and give estradiol during follicular, and then we're going to give progesterone during luteal phase. And I'm like, oh, I'm sorry. Like, how are you testing this?
Right,
How are you understanding this? Estradiol is a roller coaster.
right,
So here's the danger for the ladies listening out there. And this is mostly like I feel like functional FDNs, functional dietary nutritionists that are really promoting this. Which they can't prescribe. So they're getting like, just giving like over the counter estradiol, which is scary. So if we have a surge of estradiol and then you're giving estradiol on top of that, then we're going to be super therapeutic.
right,
And this is where DNA radical damage can happen in the breast. And there's no protection with progesterone there. It's not physiologic. Like this is just getting as bad as giving conjugated equine estrogens, right? So we don't want to do harm. Now, very, very late perimenopause, like you have tons of anovulatory cycles. Well, there's new technologies coming out. I was just at A4M and you could track your urine every day to look for FSH suppression or FSH increasing. So this is new technology. So I'm going to start investigating that because those women in that last year, maybe we could do some estradiol if their FSH is consistently high, and we're testing it every other day or every day. So, but that would be like rare cases, or you would be working hand in hand with your doctor with that. But perimenopause in general, what I do is get the luteal phase progesterone, and then if they are having vaginal dryness and complaints, it's affecting their urine, they're getting UTIs, it's affecting their sex life. Then we give some estriol, which is a weaker estrogen. We give that topically. I also love to give estriol, pea-size amount with some retinol on the face. So there are things that we can do that aren't dangerous, and we're testing and we're making sure. There's a podcaster, someone my patient had heard about because I got her saliva hormones and I'm like, why is your estradiol so high? This is not a surge, it's just so weird. Well, she was putting all over her body to help with saggy skin estradiol cream. We're talking about 3 milligrams per pump.
wow.
Yes, and I was like, "Well, I can't, like, guarantee that you didn't do harm with this, but let's detoxify you, let's get back on it, like, I'm sorry that happened to you, I'm gonna speak out against it and make sure, we have educated people out there," because when these people who are selling a product, when they try to appeal to these pain points and these women are desperate, sometimes they'll just impulse buy because these people are good salespeople. They're not in the medical field, they're in the sales field. So we just have to be careful. Ray, do you feel good about a little bit of estriol during perimenopause
Oh, yeah,
topically?
yeah, small amounts. I think it really and like
Yes.
you said, your labs and your blood work don't lie. It is so important to, understand where is it safe? Are they able to metabolize it?
Mhm.
It's so critical.
Yes.
Um,
Yes,
and
yes.
and and these are some common sense approach, and yes, at the show this year at A4M, there's over 9,000 people that attended this year, and still was a lot of we just still understanding, was there a lot of things that possibly didn't work? Yes, and it's just
Mhm.
really important. There's a lot of marketing going on, so we still have a long way to go. So that's why, it's good and, to be with, people like you, Dr. Jen, and your book. It sounds like it's a good step for people. Reset. It's available anywhere, Amazon.
Yeah, you can find it on Amazon, or you could get a direct link if you go to drjenbook.com. So super easy. You can just go to that website and grab the book. It will take you to Amazon.
And you're still taking patients, virtual, is that right?
Yes. Yes, I am. My website, you can go to Healthy by Dr. Jen. And I also have a YouTube and Instagram, Integrative Dr. Mom. That's Integrative DR Mom, where I give more hormone tips. And you could also find out about my mini farm adventure, in Tennessee. It's been good. It's getting me out in nature.
right?
Um, yeah.
Good. It's good food, good starts, it's good foundation.
Yeah, so lots of eggs. I'm gonna probably go cook some eggs and butter right now. So we have lots of eggs, and then we have some mini beef cows. So we're gonna raise them. It's just cows are very different. It's a very different thing. So it's good. I'm always learning, and with medicine, I'm always learning. With farming now, it's very humbling. Animals are a lot harder. Oh, you could hear the rooster. And
Ah!
if anyone wants a rooster, I think we're done with him. He scratched my 6-year-old this morning, right before we were getting ready to go from school. So I think that was kind of the last thing. I think is going to be dinner for someone. Yeah, because we've tried everything, and he won't attack me because I feed them. But
It's funny. I
anyone wants a
I
rooster?
I've never been on a podcast and I've had a rooster in the background, so this is a first, and
Oh,
it
yeah.
makes it real. Well, Dr. Jen, this has been an incredibly important and reassuring conversation, and we thank you for helping women understand that perimenopause isn't a failure or something to fear, but a season just to be approached with understanding, support, and intention. And for our listeners, remember hormonal transition or the sign of your body is not broken. It's important. There's not to be any guilt here, and your work is just so important. Uh, and again, I'm
Thank
Ray
you, Ray.
Solano, and well, thank you for listening. And I'm going to give you one more. Let's give us your website one more time for patients to seek you out because it's so great today. You don't. It's nice to be able to see people face to face, but being able to have virtual appointments, it works tremendous for our clinic as well. And if you can give that information out to all of our podcast listeners.
Yeah, of course. It's healthybydrjen.com.
And again, I'm Ray Solano, and we thanks for listening, and we appreciate your time today. And I hope that rooster finds a home.
Oh, thank you. Yeah, it's rough. It's the last straw.
Well, last straw. And remember, you listen to Healthy Choices on our podcast under Dr. Talks. And I always close that remember, you have a choice in your healthcare. Thanks again, Dr. Jen, and we look forward to having you again.
Thank you.
All right, take care. Bye bye.